Yeah, the Prime Minister indicated last night that it may not be a good idea to gather for Thanksgiving, so that way we could save Christmas, he said. And today, Quebec's health minister said the same kind of thing. So where do you stand on this, and what would you like to see in BC this Thanksgiving?
You know, I think Thanksgiving is an important time for us to remember and give thanks for those who we are closest to. And we've been talking about that quite a bit. There's no reason at all why you can't have Thanksgiving with your household bubble, your contact, your close small number of people. I think it is a challenge, and we would not be recommending either that you have a large family gathering where particularly elders and seniors come from other places and get together with people who have had other types of contacts. So, you know, the large family gatherings, we've been saying that through the summer as well. This is not the year for that. This is a year to participate remotely with your family, the people you're closest to make sure that you can find ways to engage in these important celebrations together without putting anybody at risk.
Here in Island Health, there seems to be a growing sentiment that another day of no new cases, only 8 active cases as of yesterday, that there isn't a need for people here to restrict their social interactions any further or avoid those larger family gatherings at Thanksgiving. What is your response to that, and how do you counteract the feeling that there isn't a second wave happening here on the island?
Yeah, I know we feel a little insular in our island here, but it is a large island, and I think I need to remind people that this virus travels with us, and we move. And when we move, we bring that risk with us of the people we've been in contact with, the places we've been. And we've seen that, and we've managed outbreaks on this island very well, and we have great systems for detecting. We've had some challenges with our testing protocols, or at least Island Health has, but we're working through those as well. So this is not a time to be complacent. We know that if we are complacent and we let our guard down, that this virus will find a way to spread, and it will spread to people that we care most about, that we're closest to. So we need to take that into account. We need to remember as we're going into cough and cold and flu season that there's going to be a lot more illness around, and it's going to be very challenging for us to figure out what is COVID, what is influenza, what's just a cold. So now's our time to start regrouping and pulling back and doing the things that led us to be in this position in Vancouver Island. So it is not a time to be complacent. And if we are complacent, that's when we put our communities at risk.
Do you have a follow-up, April?
Yeah, just so it's fair to say that despite not seeing a lot of new cases or even only 1 or 2 new cases today, that the possibility of a second wave here on the island is possible, even though we haven't really seen anything like that from this pandemic.
It is absolutely possible. We know that there's people who work in other parts of the province and work in other provinces. We know that there's risk in the Lower Mainland in particular right now, but that it has moved around the province. And so we've seen it in the north. We've had challenges in the interior, and part of it is luck and part of it is us being careful, and we cannot stop being careful.